people are scared to take care of pregnant women, because when you're dealing with a pregnant woman, you don't just deal with the patient themselves, you're also dealing with their baby. Retreat is positioned to serve this population because there's a board-certified OBGYN on staff. All of the nursing staff as well as the clinicians have been trained in how to deal with pregnant women who suffer from addiction. There are so many concerns for pregnant women who suffer from addiction. There's the regular concerns that go along for anybody who's suffering from addiction, which is the disease of addiction itself. So many people think that when a woman is pregnant, they should be able to just stop, and they can't. The brain is telling them that they need to use. So there's the additional guilt and shame of, why can't I just stop? Why can't I do this for my unborn child? Then there's all the psychosocial aspects. If they have other children at home, who's going to take care of the kids? How are they going to get to treatment? How are they going to be able to focus on treatment? There are so many aspects of care that need to be coordinated for a pregnant woman. There are multiple medications we can use to help women who are either detoxing or suffering from the disease of addiction while they're pregnant. The medications we use depend on the substance they were abusing. For women who abuse opiates, we use a medication called buprenorphine. And this medicine binds to the opiate receptors in their body and calms their brain down, giving them relief from the physical withdrawal symptoms and preventing both mom and baby from going through opiate withdrawal. We would like to keep patients as long as we possibly could, but our average length of stay is anywhere from 22 to 30 days. Every patient who leaves Retreat has an aftercare plan in place. They are set up with a therapist to make sure that they're continuing their addiction recovery journey. With pregnant women, it gets a little bit more complicated because we need to also make sure that their medical needs are met. We ensure that every pregnant patient who leaves with an appointment for a buprenorphine provider to continue that medication for the remainder of the pregnancy. We also ensure that they either have an OBGYN they've already been seeing for the pregnancy, or know who they're going to call to schedule an appointment with, or even set them up an appointment for after they leave if needed with an obstetrician. Retreat will accept pregnant women who are up to 32 weeks gestation at the time of admission. On an individualized basis, we will sometimes allow patients who are further in their pregnancies. Currently, Retreat at Lancaster County is the only retreat facility that will accept pregnant patients, because Retreat at Lancaster County is where there is a board-certified OBGYN on staff. So we have several physicians and clinical staff who work here at Retreat, and the patients, pregnant women, have access to all of those providers. Generally, they are seen by the OBGYN, by me, for their intake and for any needs, but if something arises and they need to see the psychiatrist or see the psychologist, they absolutely have access to them as well. The biggest thing I want people to know is that help is out there, and pregnant women can get help, and at Retreat at Lancaster County, we can provide that help. Don't hesitate to refer your patients who have a substance abuse disorder, and don't hesitate to screen for those substance abuse disorders, because a lot of times patients are hiding them, especially when they're pregnant.